Hello, Paul Griffin here, Director of Infectious Diseases at the Mater, here with my weekly COVID-19 update. I'm pleased to be able to report that since last week, we've seen the number of new cases significantly decline, the so-called flattening of the curve, which really means the interventions that we've had recommended must be the right ones and that people are adhering to those because they've clearly worked, which is great news and everyone should be commended for that. I guess one word of caution around that though is it is early days, and if we undo any of this good work, we could be right back to where we started from, back on the trajectory we were so concerned about really quickly. So we need to maintain doing all the right things, the social distancing, staying home, washing our hands, and particularly as we go into this weekend, the Easter weekend, where we would have previously been out and socialising and travelling and holidaying, it's vitally important that we keep doing what we've been doing so far to get that great result so that we can keep staying on top of the curve moving forward. It is a marathon rather than a sprint, as many people have said, and I can't reiterate just how important it is to keep up the good work that we're all doing. Another important thing to point out this week is around flu vaccination. So the flu vaccination has become available, and including here at the Mater, we're making efforts to try and vaccinate as many people as possible. It's important to point out the flu vaccine doesn't protect people from COVID-19, but as we move forward into our flu season, we really can't afford to have anybody unwell with anything else. So I'd like to point out to everybody to go and get your flu vaccine. And while this is maybe a little earlier than we'd normally recommend that, it's vitally important that we get it as soon as we can this year, given what we're seeing with COVID-19. There's also a little bit of fear and apprehension from people coming to hospital for other reasons, and I'd just like to highlight to everybody that we've gone to great lengths to make sure that everybody in our hospitals, staff and patients are protected from COVID-19. So if you do need to present for other reasons, I can reassure you that it's safe to do so and vitally important that people get the health care that they require. As we've seen the quarantining and travel restrictions reduce the number of imported cases, our testing criteria has also been updated accordingly. So now basically anybody with a fever or respiratory symptoms, irrespective of their history, can get tested. And I'd certainly encourage people that are concerned that they may have COVID-19 to come and get tested either here at the Mater in our fever clinic or in the community if they choose to. So again, the key messages for this week: keep up the good work with the social distancing, staying home unless it's essential, and keeping up your hand hygiene, and we'll continue to keep the curve flat and stay on top of COVID-19.